Next, we will learn about the systems in place to manage an emergency. Plain and simple, emergency management systems help us manage emergencies. There are 3 command and control structures in place that are flexible and adaptable to any kind of emergency situation. These systems can be used to respond to a small incident such as a chemical spill on a freeway to a large-scale event like Superstorm Sandy. All systems have common terminology, so all workers are using the same terms. The first system is the National Incident Management System, or NIMS. NIMS is a system used in the United States to coordinate emergency preparedness and manage emergencies among federal, state, and local agencies. NIMS is a nationwide systematic approach to incident management, a set of preparedness concepts and principles for all hazards and essential principles for effective communication and information management, standardized resource management procedures, scalable so it can be used for all incidents, a dynamic system that promotes ongoing management and maintenance. The second system, the Standardized Emergency Management System, or SEMS, is used in California to manage multi-agency and multi-jurisdictional emergencies among all 5 levels of government. SEMS was developed as a result of the 1991 Oakland Hills fires when 25 people were killed in less than 12 hours. Senator Petrus authored Senate Bill 1841, which was chaptered as Government Code Section 8607, effective January 1st, 1993, to establish by regulation the SEMS framework. All state agencies are mandated to use SEMS, yet it is not required for local governments or special districts. However, local government and special districts are encouraged to use SEMS to be eligible for reimbursement of response-related costs. SEMS facilitates the flow of information within and between responding agencies and facilitates the coordination among all responding agencies. Further, SEMS facilitates rapid mobilization, deployment, and the use and tracking of resources. SEMS framework incorporates 4 concepts: the Incident Command System, or ICS, Interagency Coordination, California Master Mutual Aid Agreement, and Operational Area. We will talk more about ICS in a few minutes, so let's start with the second concept, Interagency Coordination. Interagency coordination means the participation of various agencies and disciplines involved at any level of SEMS organization working together in a coordinated effort to facilitate decisions for overall emergency response activities, including the sharing of critical resources and the prioritization of incidents. The third component, the Master Mutual Aid Agreement in California, was originally signed in 1950. Under this agreement, cities, counties, and the state joined together to provide for a comprehensive program of providing services, resources, and facilities to jurisdictions when local resources proved to be inadequate to cope with a given situation. The fourth component is operational area. The operational area is one of the 5 levels in SEMS that we will discuss next. SEMS has 5 organizational response levels: field, local government, operational area, region, and state. Field level. The field level is the level where emergency response personnel carry out the tactical operations in direct response to an incident or threat. The second level of SEMS is the local level. The local level includes cities, county departments, and special districts. They manage and coordinate response and recovery activities and have jurisdictional authority over field response and resources. Operation area level. The operational area manages and coordinates information, resources, and prioritizes among local governments within the operational area. The operational area serves as the coordination and communication link between the local government level and the regional level. In San Luis Obispo, this area includes 7 incorporated cities and over 30 special districts. In addition, locally based state agencies such as Cal Poly, California Men's Colony, and Atascadero State Hospital are included in our operational area level. The regional level manages and coordinates information and resources among operational areas within the region and also between the operational areas and the state level. The regional level also coordinates overall state agency support for emergency response activities within the region. State level. The state level operates the State Operations Center, or SOC, and is responsible for coordinating resource requests and resolving priority issues that might arise at the region level. The SOC is also responsible for coordinating with FEMA and other federal agencies. At the state level, the California Department of Public Health Emergency Medical Services Authority and Department of Healthcare Services coordinate operations at the Medical and Health Coordination Center during emergencies. The Medical and Health Coordination Center is a state-level public health, environmental health, and medical emergency operations center that coordinates information and resources to support California's public health and medical response. There are basic features that are used at each SEMS level. Essential management functions. 5 primary functions are required for use at all SEMS levels: command, operations, planning intelligence, logistics, and finance administration. Management by objectives. Each SEMS level should identify measurable and attainable objectives to be achieved. Action planning. The use of action plans provides designated personnel with knowledge of the objectives to be achieved and the steps required for achievement. Organizational flexibility and modular organization. At each SEMS level, only those elements necessary to achieve the desired objectives should be activated. Unity of command requires individuals working within an organizational structure to report to only one supervisor. Span of control establishes a 1-to-7 ratio as the maximum span of control under emergency response conditions. Personnel accountability is accomplished through the organizational unity and hierarchy of command management, along with the use of check-in forms, position logs, and various status keeping systems. Common terminology is generally used to describe organizational elements, position titles, facility designations, and resources. Resource management occurs at all SEMS levels in various ways. At the field level, the use of resources is tactically directed. At levels above the field, resources are coordinated and prioritized for use at the field level. Integrated communications. Throughout all SEMS levels, there must be a dedicated effort to ensure that communication systems, planning, and information flow are being accomplished in an effective manner. SEMS establishes a check-in process to ensure accountability of personnel. Staff can use sign-in sheets or rosters to capture staff time. SEMS also establishes that personnel at all levels should receive an incoming briefing as well as regular briefings during their shift. The briefing should include current situation assessment, identification of specific job responsibilities expected of you, identification of coworkers within your job function and/or geographical assignment, availability of communications, location of work area, identification of eating and sleeping arrangements as appropriate, procedural instructions for obtaining additional supplies, services and personnel, and identification of operational period work shifts. Finally, SEMS establishes a demobilization or going home process. Demobilization requirements will vary by agency and SEMS level, but general SEMS demobilization considerations include complete all work assignments, brief subordinates regarding demobilization, complete and file required forms, and return any equipment. The last emergency management system we are going to cover is the Incident Command System, or ICS. This system is a component of both the National Incident Management System and the Standardized Emergency Management System. The ICS is the organizational structure used to command, control, and coordinate emergency response resources. Management. Directors, responsible for overall emergency policy and coordination. Operations. Doers, responsible for carrying out the tactical operations of the incident response. Planning and intelligence. Planners, responsible for collecting, evaluating, and disseminating information. Logistics, the getters, responsible for obtaining facilities, services, personnel equipment, and materials to support the event. Finance administration, payers, responsible for tracking all cost and fiscal activities. Now that we have covered the many emergency management systems, let's take a closer look at the role of the health agency in an emergency. The health agency's primary mission is to coordinate the medical and health response during an emergency. The health agency is the lead responder in communicable disease outbreaks or a mass casualty incident and takes a supportive role in all other disasters, such as a nuclear power plant incident, earthquake, or flood. The responsibilities of the health agency include activating the County Health Agency Department Operations Center, or CHADOC. CHADOC may activate health agency emergency response plans, including the Strategic National Stockpile Plan, Pandemic Influenza Plan, and the Crisis Emergency Communication Plan, among many others. Health agency has distribution site plans called point of distribution or POD sites. These sites are for the mass dispensing of medications or vaccinations to prevent the population from biological threats or epidemics. Routine medical care is not provided in a pod. We invite you to take part in a pod drill, which usually happens annually in the fall.